Thank you to the Progressive Coalition of Labor and Healthcare Advocates for organizing today's healthcare rally. From Progress Ohio, HCAN, and Planned Parenthood, to the AFL-CIO, UFCW, and SEIU, to Columbus Jobs with Justice and the Ohio Alliance for Retired Americans, each of you is playing a critical role in shaping the progressive era of this generation. I wish I could join all of you who have traveled from across Ohio to reaffirm your commitment to establishing a health insurance system that doesn't exclude or cheat or abandon any American. I'm taping this message in Washington on February 11th, one day after an historic blizzard that shut down our nation's capital, something, frankly, Republicans have been trying to do for months now. But despite the scare tactics, despite the fear-mongering, despite the stalling in the partisanship, we find ourselves still with a momentous opportunity to change our nation for the better. That's due in large part to your hard work, talking with your neighbors, organizing in your communities, calling your elected officials. You know how to be activists. Your commitment to progressive principles is making a difference. I recognize your frustration that a clear electoral message of hope and change has been mired in crass political strategy and the politics every day of delay and denial. I share your belief that we can wait no longer. We can't sit idly by while hardworking middle-class Americans continue to be frustrated with health insurance that is nearly impossible to afford. Last week, Anthem Blue Cross announced that 800,000 individual policyholders in one state in California will be subject to rate hikes of 30 to 39% this coming year. That's simply unacceptable. Every day, Ohioans are stuck with health insurance that fails to protect them from catastrophic health care costs and forces them into bankruptcy. Every day, Ohioans deal with health insurance that freely discriminates based on age or gender or location or medical history. Across Ohio, small businesses are shackled with high-cost healthcare cost insurance plans, forcing them to cut back on coverage, in some cases drop plans altogether. Some 400 Ohioans every day are among the 12,000 Americans who lose their health insurance every day. Equally disturbing, about 1,000 people every week die in this country because they lack basic health insurance. They and we simply can't wait any longer. We need your help. We need your help to keep moving forward, to demand that our nation stop rationing health care based on health status and insurance status and financial status and wealth. We need your help to demand that our nation hold health insurers accountable for paying health claims, not avoiding them, for covering the sick, not abandoning them. Simply put, we must demand that health insurers do their jobs. We can't let the insurance industry stop us, or the drug industry stop us, or the pundits in Washington or people here stop us, or let inertia stop us. We can't let more people die just because health reform is an uphill battle. We've simply got to keep climbing up that hill. I'm fighting for healthcare reform now. It's a privilege to fight alongside all of you. So I ask you again, get the facts out as you've done. Fight the distortions as you've done. Show the world how change in Ohio and America happens. I'll close with a quote from Mississippi civil rights activist who said some 40 years ago today. Who said some 40 years ago. Don't tell me what you believe. Show me what you do, and I'll tell you what you believe. Thank you for showing us what you believe. Let's make sure we finish health care reform and do it right. Thanks.